Okay, my name is Celeste Magers, and I've been one of Dr. Nemit's clients for about 8 years now. And I was really excited when he started to offer stem cell therapy
Yes.
because it was something that I wanted to try. I have several autoimmune conditions that I've had virtually my whole life, and I wanted to see if we could make an improvement in those. And I also wanted to see if I had a minor heart attack last year when I was under a lot of stress dealing with caregiving for my mother who was dying. And I'd had residual heartbeat irregularity after that. And I wanted to see if the stem cells would help my heart get back to more normal beats.
And how did they do with your heart?
Well, with my heart, I'm a data nut, so I every morning I meditate and I hook myself up to a heart rate variability program on my computer. And so I can see like a trace of where I have irregularity and where it's going nice and smooth, like this picture here. This is like good and this is not good. And so I actually count the number of irregularities on these graphs and I keep a log. And so when I started, I had certain numbers, and then after 7 weeks after the stem cell treatment, my numbers are like down about 35 to 40, almost 50% on the number of irregularities.
I think actually this was your picture.
Yeah.
So this was before and after.
That's right.
So the one on the top was before
Right.
the irregularities, and the one on the bottom where it looks more smooth except for the one little
Right.
bump, that was after the stem cells.
Right, and when I'm in good heart rhythm, it's supposed to look like this. But when there's all these irregularities going on, I can feel it as a little fluttery in my chest and sometimes big thumps in my chest, which is the big upright bars. And that's a lot less now than it used to be.
And then you had some psoriasis,
Yeah.
which we have 2 pictures of that. And you said that was what? How much percent improved?
I don't know if I gave, 20 to 30% improved. I mean, you can see the top is these completely filled in circles with psoriasis. And here you can see them starting to break up in the middle.
Great. And that was just 7 weeks out.
That was just 7 weeks, yeah.
Very
And I've had
good.
this psoriasis since I was 4 years old, so
wow.
seeing an improvement on it is really kind of amazing.
And then you said your joint, the rheumatoid arthritis with your...
Yeah, I have rheumatoid arthritis. I've had for about 35 years, and I have 3 damaged joints. This is one of them. And this joint feels less red and hot, and it's a little smaller than it used to be. And then I have 2 toe joints, same thing. It's like they're a little smaller. They're not as sensitive as they were.
That's great. And then we just did your pre and post scans. If you hold that up, we can see the inflammation. So this is of the abdomen. The lower was the first abdomen and back, and the red and orange and yellow is the inflammation. And on this one over here, I even had white on the one side and in the center. And then this is what we just took this week, which was 7-8 weeks later. Now we're getting the blue-green, which is normal. The red is going away. That's the front abdomen, and that's the biggest indicator of inflammation leaving the body. And then in the back scan, we can see we went from very dark red and white to much lighter, more orangish red. So that's great. At this point, your inflammation is going progressively down. You've had almost a 50% change in improvement in your heart. You said 25 to 30% with psoriasis and about 10% in the rheumatoid arthritis.
Right.
So exciting, so exciting.
It is exciting, and I'm expecting more change yet because
Yes.
we're only just a couple months into the process of having the stem cells doing their thing.
Well, great. Thanks for sharing this, Celeste, and we'll have another testimony a few months down the road.
Okay, very good. Thanks.